of Representatives, this bill is going to pass by an overwhelming bipartisan majority, as it passed in the last Congress as well, at least twice. But the difference is this bill will be signed tonight by the President of the United States. President Bush vetoed this children's health bill twice. And it's interesting to review the arguments he gave for rejecting the legislation. First of all, he said, there's no problem for children getting health care when they need it. They can always go to an emergency room of a hospital. Of course, the care in an emergency room of a hospital is the most expensive care, and it often means that the child has gotten sicker than otherwise would be the case and is forced to go to that emergency room as the only option. And the second reason he gave for vetoing the bill is, to me, one of the most astounding. He said, why should taxpayers subsidize parents for their children's health insurance if the parents could afford to buy a private health insurance plan for their own children? Well, many parents just can't afford it, or will not have that as an opportunity because of a pre-existing medical condition. But think of that argument. Suppose the President of the United States said, we ought not to have public schools for children whose parents could afford to send them to private schools. I find that a remarkable argument for him to have made. We in this country should value the opportunity for every child to succeed to the fullest extent of his or her ability. And that means education for all children and health care when those children need it. We will see the President of the United States sign this bill tonight because election results make a difference. And we will have a president who will sign this bill into law along with a bipartisan majority in the House and the Senate. And that will be a happy day for America's children.